Welcome to the Businessmen and Women of Color podcast. I am your host, Ann Alston, and it is my pleasure to bring quality programs to all of you. I am so excited to be hosting this podcast again this year. We have lots of great, amazing speakers who are here to give information to you. So please be sure to visit and listen to all of the podcasts and visit all of the pages. And if you feel that there's somebody out there that can provide you additional information, please feel free to reach out and touch them and connect with them. This is a unique opportunity, so please don't waste it. Just in case you did not know, the purpose of the Businessmen and Women of Color podcast is to network our small businesses, share information, and to provide needed information for career seekers. I would also like to take a moment to thank our corporate sponsors, our family of authors, Butler Armstead Consulting Solutions, Human Resource Learning Center, J&F Enterprises, and Women Offering Wealth, along with all of our business sponsors who is helping to make this event a success. Before I introduce our next amazing speaker, and I say amazing because I'm really excited to talk to him, I kind of want to put out a disclaimer just because of the nature of this particular podcast. This podcast is basically going to be talking about an interesting topic. It's one of the hottest topics out there in terms of the White House, the government, and citizens, the Affordable Care Act. And so the speaker who is going to be on here today is not a lawyer. He's an advisor. So therefore, any information that you hear from this podcast is for information only. So I just want to put that out there. So we're going to be talking about the Obamacare, better known as the Affordable Health Care Act. Currently, over 12 million people are on this service as of now. And as of 2017, there's a record number of 6 million of new enrollments. So that speaks to value. So regardless of what the news says or what the outcome of the Affordable Health Care Act and all of the things that's going on in the White House, our next speaker is here to actually teach us what exactly is Obamacare, what exactly is affordable health care. Are they the same or are they different? How it really works and what it means to us as a small business owner. So with that, I would like to introduce Eugene Poole. Eugene is a senior level healthcare executive with more than 30 years in the industry. He provides strategic management and training for healthcare insurance executives. He supports cost-effective family and group healthcare compliance solutions for commercial companies, and he also provides senior level program management healthcare solutions and many more other different services throughout the DMV area and all 50 states. Eugene is certified by the National Association of Health Underwriters on the patent protection of the Affordable Care Act, which is only awarded to health insurance professionals who have been proven and approved in all 50 states for providing continuous education. He has so many different areas of his expertise, and he's a noted speaker. Some of his topics that he's been known to talk about have been implementing the healthcare reform, talking about the reviewing the policies, the overview of the plan, different plans that small businesses have pertaining to tax credits, and many other topics. So with that, I would love to introduce to the podcast Eugene Poole. Welcome.
Thank you, Ann. Appreciate it.
No problem. So, Eugene, tell us about you, what you do. What is the Affordable Care Act that many of us do not really understand about it? Because there's some articles that I saw out there today that talked about that we think it's the same or we think it's different. What exactly is it?
Well, first of all, I think that's an excellent question. I think it's fair to say I shouldn't gloss over certain things because people are tweeting today, they want to get to the heart of the issue and they want to jump to this tweet and that tweet. And it really just requires that we all as a society slow down just a little bit to really hear what the program's all about and what does it really do. Now, the patient protection part of the Patient Protection Affordable Care Act, the patient protection part was they got rid of the term pre-existing condition. They didn't want you to buy products or insurance products that really did not protect you against liability in the terms of the healthcare provider, and you're not being covered. Because when they got rid of the pre-existing condition rule, this solved a lot of problems. And they also got rid of this idea of, if they're going to cover you, you're covered. They didn't want to have companies medically underwrite you after you are now sick, and now they're going to tell you that it's a pre-existing condition. So the patient protection, that's the protection part of the act. Is let's protect people from this legalese stuff that gets people in trouble, because according to a Transamerica study, 60% of all bankruptcies in this country is due to medical bills. 60%. 50% of all mortgage foreclosures are due to medical bills. But the saddest part about all of this is that 80% of the people have health insurance. That tells you that people don't really understand what they have and what they don't have. And a lot of people are speaking about all these things, but they really don't have a good understanding of what it is and what it does. Now, the Affordable Care part of the Act says basically, if you have premiums that exceed 9.5% of your adjusted gross income, and just let's say I'll make the numbers really simple as far as, and a lot of people are not making $100,000, I'll use this as an example so you can clearly see what we mean. If someone earns $100,000, let's say that happens to be their adjusted gross income, it means that the premium that you pay for that year cannot exceed $9,600. If the premium exceeds $9,600 for the year, that's you and your family, then it's deemed unaffordable, and then therefore there would not be a penalty. So what the Affordable Care Act did is that it quantified and standardized things so that people have a clear picture. Also in the Affordable Care Act, there are 10 essential coverages, 10 essential health benefit coverages that a qualified health insurance company had to provide to you, had to be in the program. So if they're selling their health insurance program on the exchange, whether it's the Federal Health Exchange, Maryland Health Exchange, DC Health Exchange, these programs have to have 10 essential coverages. And that has to do with ambulatory outpatient care without being admitted to a hospital, emergency services, trip to the emergency room, hospitalization, treatment in the hospital for inpatient care, maternity and newborn care, 5 mental health services and addiction treatment, 6 prescription drugs, 7 rehabilitation services and devices, 8 laboratory services, 9 preventative services, and 10 pediatric services. Those are better known as the 10 essential health benefits that a qualified health program must have in order to be able to sell it legally on the healthcare exchanges throughout this country. Now, one thing I want to mention about this preventative services, a lot of people will say, well, my premiums are going up and I have all these problems, I have these big deductibles. On preventative services, this includes counseling, preventative care, physicals, immunization, screening, cancer screening. All these are designed to detect or prevent medical conditions. Also care for chronic conditions such as asthma and diabetes. So even though the list is greater, the beautiful thing about this preventive care part is that those things that they pay for are not subject to the deductible. Because they figured out that people were not going to the doctor because they didn't have the money to get the physical done. So what happens is that they let things metastasize and get things worse. But by the time they hit the emergency room, we're going to pay 3 or 4 times for this person because they simply didn't have the money to go in and see the doctor or the hospital or get the lab test done or the screening or the mammography, So they figured out, listen, it's better to catch people on the front end. And even if they don't have all the money for everything, at least we can catch this thing and nip it in the bud. That's the beautiful thing about that. So what the Affordable Care Act did also was that, so it standardized the insurance features, the benefit features, the 10 essential health care benefits all carriers had to have in their program if they were going to be considered a qualified health plan. So the first thing it did, it protected the patient against underwriting at the time of care, so that getting rid of the pre-existing condition clause. So that way that when you go in, you're going to be able to get care. And that's one tell you that, well, you should have known that you were pregnant before or whatever. And that happened to a lot of people, by the way. There were a lot of people who were pregnant and didn't know. And they said, well, you should have known because the due date is this. Well, I mean, we don't have a cookie-cutter society.
Right.
Not everything goes as planned. So they wanted to get rid of all these ambiguities, these things that cause really a lot of stress, because the birth of a child is very expensive to have the claim denied because they said you were pregnant and you didn't know about it. That's just one of those things that were just deemed to be unfair to people. So at any rate, they got rid of that, and it was a very good thing. Now, the challenge that we're faced with is this. The program worked very well, and some of the challenges that we're faced with is the fact that a lot of people feel like, well, I don't want to pay for Johnny Jones over here or Mary Sue over there because their problem is not my problem. But I'm here to share with you that what people keep missing is that health insurance was not started as a political event. Health insurance was started in Dallas, Texas, 1929 with Blue Cross and Blue Shield, the school teachers. And the school teacher said to the hospital administrator at Baylor University, we don't have the money to pay you if we get sick. What can we do? So the hospital administrator said, listen, if you teachers will pool your money together and each agree to pay 50 cents a month, when you get sick and you have to go to the hospital, the money would be there to take care of you. So all of insurance is about pooling money for various risks. So it has nothing to do with political party. It just has to do with how do you save up enough money to cover someone should they become sick.
Okay, that sounds fantastic. That was a lot of information, Eugene. Thank you for that. I kind of want to step back a little bit and kind of delve deeper into some of the other core issues. Why do you think is such a misconception about the use of Obamacare versus just getting regular health insurance and the fear? I know there's a lot of people who got it because, they felt that this was their only shot to get health insurance. And then you have other people who I know that looked at it and felt this is still expensive, but they don't really know that much about it. What is the underlying problem of why there's such a misconception about the use of Obamacare?
Well, the thing about it is that it's, first of all, it's fear and it's just misinformation, basically. Let me share with you about the benefits where you buy off the exchange or on the exchange. The first thing is that whether you use Obamacare to help you pay for it or you buy it off the exchange, the rates from the insurance companies is still the same. In other words, if you're going to buy a company A or company B, whether you buy it on the exchange or off the exchange, the rate is exactly the same program. The only reason why you would use the Affordable Care Act is because you want to be able to take part of your personal taxes, not anybody else's taxes, by the way, get part of your taxes advanced to you in the form of a monthly premium to help you pay for it because you can't afford it. So what Affordable Care Act did basically says, listen, if we are within the realm of the 9.66% of your adjusted gross income, like, for example, if you make $46,000 or less and you're single and your income is above the federal poverty level, you could get help paying for the insurance premium using your own tax credits by them advancing your own tax money to you. It has nothing to do with anybody else. This is why this is such a huge misnomer.
Right, right. And so then that would mean that whatever tax refund that you or credit that you would have gotten is actually going towards your health benefit as
That's
opposed
correct.
to your pocket, which
Exactly.
which I can see why some people might fear that because there's a lot of low income families that rely on that income tax at the end of the year.
Yes,
So
yes.
having that money allocated to health benefits is still a good thing, but on the other end of the spectrum, that's money that you're not receiving, to help for your living expenses per se.
Right,
So,
right. But see, here's the thing. If someone's income is below the federal poverty level, and when I say federal poverty level, what I mean by that is that if you're single, $16,000 and below, it's the 138% of the federal poverty level, you would get Medicaid. And that's where the system would then put you into the Medicaid program because of low income. So in other words, you qualify for help with the government assistance because your income is not able to sustain the expenses that are incurred with healthcare. So what they do is that they automatically put you into the Medicaid program, and in that program is an eligibility on a month-to-month basis. So as your income changes, as your income goes up, and you pull out of that federal poverty level, then you go into the Affordable Care Act. And then if your income goes above the $46,000 as a single person or $99,000 as a family of four, then you could buy it on the exchange or off the exchange. But the reason people use this is because A lot of people have never had coverage.
Mm-hmm.
And yes, you're absolutely right. I did taxes for 30 years. I understand it. I understand why people take refund anticipation loans, even though that
Mm-hmm.
they may pay a high fee for that.
Right.
They need their money like yesterday. I get it. I understand it. So, but the thing about it is that one medical bill can wipe you out. One medical bill, because you're not part of the system. You're not part of the insurance programs. Because let me give you an example. If you see a semi-private room in a hospital and they tell you that the posted rate is $2,000 a day, your insurance company might only be paying $500 a day. But you walk in there off the street, they're going to charge you that full $2,000 a day. Why? Because you're not part of a group. You don't have an agreement. You don't have any of those things in place to protect you against the high cost of medical care in this country.
Wow.
You have to remember that we are in a capitalist society, mm-hmm. and where the bottom line is profit, and people forget that. And so, would you rather not have to go bankrupt or have to make an economic decision because you're going to have a child or mm-hmm. your parents get sick or anything? I mean, the other thing we have to remember is this. The whole Medicaid program came into existence, and Medicare came into existence with Lyndon Baines Johnson's War on Poverty in 1965. And the program was designed on Title 18 and Title 19 of the Social Security Act. One established the Medicaid program for people who were at the federal poverty level so that they would get coverage that they would not cost them out of pocket. And for people who reached 65 would not have to go bankrupt trying to stay alive when they've lived a full life. You could be middle class all your life and have one major medical care in your life, and all of a sudden you lose your house, you're bankrupt. So what they were trying to do back as early as 1965 is prevent financial catastrophe. That's all they were trying to do. It has nothing to do with Democrat, Republican, or any of these other things. It has to do with the fact that this is what our society was dealing with. If you go over to Canada has a national health system, and England has a national health system. It's just that we have a capitalist system, and, there's always that tug of war between profitability and financial stability. So we have this tug of war in this country going on all the time about those issues. But the reality is that, would you rather go bankrupt? Mm-hmm. And then what happens is if it happens again and again, you may never recover financially.
Yeah, that is absolutely so true. It's so true in so many ways. The more I'm listening to you and how this is all made up, it's all designed to either you're going to be financially stable or you're going to fall under the bridge. And
yes.
A lot of people are feeling like they're falling under the bridge.
Mm-hmm.
So I'm not sure how this would affect people going forward, knowing that there's going to be some major changes in terms of the Affordable Health Care Act and how that's going to affect people who are currently on it now or people
mm-hmm.
who currently need it. But it's definitely a huge problem. And I kind of want to turn the conversation a little bit toward the small business owners because just like myself, as a emerging business, soon to hire staff and have to provide health coverage, I can actually say and honestly say I am not sure how this affects me. So
okay.
can you just break it down in a way that many of us can understand? How would this affect a small business owner who are like one single, two people business owners, maybe some solo entrepreneurs that may need to hire somebody and provide some type of health coverage for their staff?
Okay, so here's how the healthcare program was designed with small businesses. Number one, if you have less than 30 full-time equivalent employees, which means 30 hours a week, not 40 hours a week, by the way, and you have less than 50 employees, you're not required to provide health care, period.
Wow, I didn't even know that.
Yeah, that's why I'm going to break it down
Yeah,
real quick.
because they don't say that. They
I
really do
know.
not put that out there.
Well, you're not required to provide it, period.
Okay, I'm pretty sure everybody who's listening to this, who will be listening to this podcast, is probably doing a
yeah.
like what?
Okay, so here's what happens. But the government say, listen, we realize that business is just getting off the ground. You don't have the cash flow. You don't have a lot of established contracts and all the other things that you really need to get your business off the ground. Now, however, what we're going to do, if you have less than 25 employees and the average salary is less than, say, $25,000, what the government says is that if you as a business owner decide to provide health insurance, and what a lot of employers will do is they'll say, well, we're going to provide it. We can only afford to pay 50% of the single rate. Okay, we can't afford to pay for your kids and your wife, everybody, or your husband, everybody, but we can afford to pay for 50% of you as the employee. Whatever your rate is, we'll pay 50%. So what the government says, if you're a small business and you're under 50 employees and you pay at least 50% of that individual rate for that employee, you can apply for a 50% tax credit at the end of the year to help you pay for it.
Okay.
So let's say for example, if the premium for the single rate is $300 a month, and you as an employer say, hey, John, I want to pay $150 of that $300. So because you're a small business, the government says, look, if your average salary is $25,000 or less, and you have less than 25 employees, we will give you a $75 a month tax credit, but you have to apply for it all at the end of the year. Because you're paying $150, they give you 50% credit of what you pay. So this is the carrot part. They're trying to help you to provide health care to your employees. But it is not mandatory at all.
Right. And then there isn't any information that really says all of that so that we can fully get the whole scope and breadth of that
That's why
information,
you have to
and it
talk
makes
to
it very confusing.
This is why you have to talk to professionals like ourselves that do this every day for a living. So the other part everyone hears about is the fact that if you have 50 employees or greater, then you were required to provide health care to your employees. Okay? That's the part people hear, but they forget about the fact that if you have under 50, you're not required to provide it at all.
Yeah,
Okay?
that's all I've been hearing is, the latter. That's all I've been
Yeah.
hearing is the latter. And I'm like, well, how am I supposed to be able to afford that if I'm
Right.
still, trying to get my bearings as a small business person,
Right.
and maybe it's just me and maybe two other people. How
Right.
how would that, and what if you're a nonprofit? Does that apply to nonprofits as well?
Yeah, nonprofits, if they have more than 50,
Mhm. Yeah, it
but
doesn't matter.
but the thing about it is that under 50 employees is a criticality, and number two, these employees must be W-2 employees, not 1099.
Right.
Okay, so they're very specific about it. Has to be W-2 wages, has to be less than 50 employees. As an employer, you're not required to do it. However, if you do it, they'll give you a hand. At the end of the year, you can apply for a tax credit.
Okay.
So
Awesome.
that's how that works. And so when they started with the Patient Protection Affordable Care Act, they thought initially that everybody would be able to do this whole thing on the website. And everybody would be hunky-dory. We don't need the brokers. We don't need the agents and all that kind of stuff. Well, let me tell you, they tried to do that. It was a total disaster. People like us who study this for a living knew that would be a disaster because healthcare there's a lot of legalese to healthcare. There's a lot of product knowledge. There's a lot of training that we have to take constantly. I'm constantly studying, and so by the time I talk to people, like I volunteer over at one of the health exchanges here in town, and some of the people they qualify for Medicaid, some qualify for the Affordable Care Act, and some don't need any help at all. But because of my training, I'm able to cover the whole gamut for whether you're below the federal
Mhm.
poverty level, at the federal poverty level, you're middle class. I deal with this whole gamut of people. So I deal with
Okay.
it both on the individual side and I deal with it on the company side.
Okay. Well, give us some more information about the type of services that in your background and all the certifications you have. I'm pretty sure people will want to know the extent of your expertise because this is really good information, and I want people to be able to reach out to you
Mm-hmm.
just to kind of get it if they have questions, deeper
Yes.
questions than what this podcast can provide. I would love people to know exactly what you do.
Right, right. Well, one of the things they can do, they can always call. My phone number is 301-925-2050. It's my office number. And my website is www.aligned, one L, ALIGNED, benefits with an S, group.com. And you'll see on our website that we have both domestic programs as well as international medical insurance. A lot of people don't know that when you leave the borders of the United States, your health insurance does not protect you. You don't have any coverage. So if you're going down to Jamaica, another country somewhere, you don't have coverage. People assume because they have these famous name companies that they have coverage. They don't. So they have to purchase international medical insurance. I sell those programs too. But I also help people coming into the country who don't qualify for the Affordable Care Act, and they're coming to the country for visits. So I provide international medical insurance to students, to other people coming into the country that need to have some form of coverage should they become sick in this country. So you see, this is a much broader topic. It's an international topic. It covers a wide list of things that people haven't even thought about. I cover things that have to do with, how does an HMO differ from a PPO, from a health savings account? What do they really do? What do they really mean? How does it play in the system? So I cover all of those topics. So by the time I'm done with my clients, and I recommend the programs, and we get it done for them, they're very happy. Now, a lot of people will ask me, well, why should I talk to you as a broker and not try to do it on my own? Well, as I mentioned earlier, the training, you just be blown away. I can't tell you the number of lawyers, doctors, and people that I work with who are in the legislation and other places that don't understand the Affordable Care Act. I help all kinds of people because what happens is people go out and they drum the stick and they beat the chest and everything, but when it really comes to how to get it done, that's when they have to call me. They really don't know the first step about how to go about getting it done. Now, from a background perspective, I retired from a major insurance company. I was in charge of broker sales, where I trained literally hundreds of health insurance agents in the field, in the group health insurance market. So this is a field that's near and dear to me in this regard. But I also did healthcare information technology. So I worked with a lot of the databases, the Centers for Medicare and Medicaid Services. I did state of Maryland. I've done, work with state of Ohio, the Medicaid programs. So I even know the databases behind all this. I know when they work, when they don't work. I happen to be a certified project manager for information technology. So I was the guy that ran a lot of these programs and managing these programs and these projects at the state, local, and federal levels. But I was also an agent. I'm licensed in Maryland, Virginia, D.C., Delaware, and Georgia. My certification is with the National Association of Health Underwriters, and this certification is highly recognized by all 50 states, was approved in all 50 states as subject matter experts. And out of 100,000 agents, only 4% of us have the certification. I just happen to be one of the 4%. And then I have an MBA. I have a second master's in cybersecurity policy. So, and having trained a number of health insurance agents, worked with companies and groups and their benefit programs, I think it makes me uniquely qualified in that regard. The other thing I'll say about all this is that why you may want to use someone like me is because you can't pay me. The way it works is that the Affordable Care Act made it so that any broker or agent who is qualified and certified and appointed can close the program for you. The state government can't do it. They must go through a broker. Even if you go to the website and say, I found what I think I wanted, they cannot sell it to you. They have to assign a broker to you. And the broker's fee is automatically included in the premium. So wow. If you could fumble around trying to figure out which way is up, or you talk to a real expert who knows how to do this stuff, and they get you through the process, and it doesn't cost you any more money out of your pocket.
Wow. That's phenomenal, Eugene. I'm really floored because first of all, I've heard so many good things about your background, just listening to you now and reading your bio. And then just for the fact that you also have two of my favorite certifications, which, I have a master's in cybersecurity policy and a project management certification as well. And so I kind of feel that all of those things marry together very nicely. And for anybody who's a career seeker, obviously this is a phenomenal industry to get into in terms of insurance. It's not just selling health insurance, as you stated. It's basically a broader spectrum of making sure that people have the right information to protect not only their personal health, but also their professional health. And so, that is really phenomenal. I will say for the last question is, what advice would you give business owners or career seekers in terms of either the Affordable Care Act or just getting into your type of industry, what type of advice would you give to them?
Well, I would say that one of the things I tell people is that I'm a big believer in the organizations. Just as we have the Project Management Institute for project managers. Get to the best practices. In the case of healthcare, the National Association of Health Underwriters is a very good nationwide organization that covers all of these topics. I get a lot of information from them on a daily basis, how the law is changing, what our president's going to do next. Get yourself immersed in what's going on. And then you don't have to make a decision right away. I would just say just become familiar with what the issues are. Because what I find is that because I'm right in the thick of all this stuff, I'm always in demand. And because I basically impart good information to people, the carriers pay me. When people decide to make a decision about one thing or another, I just don't get paid for anything with Medicaid, but that's okay because I love helping people. So it doesn't matter to me whether you get your coverage with Medicaid, the Affordable Care Act, or you can afford it on your own. I can help you in all three of those categories. My concern is that you get coverage so that you don't end up bankrupt. And that's what I see as the tragedy in this country is that no one should be going bankrupt to pay for their health care bills.
Absolutely. So this is a networking event. What is it that you are seeking in terms of what you need help doing or want to connect with someone about? Do you have anything in mind in terms of that?
Yes. I'd love to give talks in front of people because I find that if I spend my time educating, the business comes automatically. I don't have to worry about, I don't have to try to sell something to anybody because once people have a clear understanding of how things work, they'll make a good decision. I still believe in people's ability to make good decisions. I just think that we have too much noise in the channel with everything from the internet and tweets and Twitter and this and that. It's just so much coming at you. You don't know what to believe. It's overload. So I would say that if you're not sure, and you're not sure from a career perspective, I'm happy to come out. I speak at high school events. I speak at lots of churches and things to break it down so people can understand it. So I welcome that opportunity to speak anytime because the more people are clear about things, then they'll know how to prepare for what's going to happen. And I would just say that as they talk about repealing the Affordable Care Act, the president found it more difficult than he thought it would be because reality is that a lot of people who even elected him are on the Affordable Care Act. So, and now they realize that they're going to lose their coverage. Mm-hmm. So, that's why I say that there's a lot of misinformation. People don't really realize and take the time to analyze. Wait a minute. It seems like as a society, we've lost the ability to critically think. So I think we've just got to get back into that and talk to people who are subject matter experts in the field, like myself, and who do it every day, and enroll people every day, can tell you exactly how it works.
Exactly.
And that way you won't be misled.
Exactly. And thank you so much for that. And that's the whole purpose of this entire podcast is to get the right information to everybody who can use and benefit from it because there's a lot of miscommunication, there's too much media, and as you said, there is a lot of noise out there. So the podcast purpose is to get people like yourself, subject matter experts, to come out and share their industry information so that we can grow better as a strong community. Everyone, please reach out to Eugene if you would like to have him come and speak at your events. His contact information and bio information is on this page. Please also make sure you reach out to all the other speakers and share, like, and invite people to come to the podcast and check out a speaker because we're only better if we share the information. So with that, Eugene, I want to thank you so much for being on the podcast today. I really enjoyed your conversation with me.